Welcome to this afternoon's discussion, The Dilemma Facing America's Schools During COVID-19. I'm pleased that so many of you could participate in this extremely timely conversation. Earlier this week, the Academy released the final report of The Public Face of Science. Over the last 4 years, that project, chaired by Richard Meserve, President Emeritus of the Carnegie Institute for Science, has leveraged the expertise of scientists, journalists, policymakers, and the legal community to explore the public's relationship to science, considering how science is communicated through the media, the factors that influence public confidence in science, and how science impacts public policy. I can't think of a more compelling and immediate illustration of the complex and often fraught dynamics between science and society than the national dialogue around opening schools this fall. As the pandemic enters its 7th month, Americans remain unable to agree on basic facts about the virus, and communities continue to struggle to control the spread, leaving teachers, students, parents, and administrators with few good options as the fall school year approaches. Amid the partisan fighting and under tremendous scrutiny, school leaders and public health experts are working hard to make thoughtful, evidence-based decisions that prioritize the learning needs of students and the health of their communities. We are lucky to be joined this afternoon by 2 experts who are deeply familiar with the competing priorities facing school communities this fall. Austin Beutner has been the superintendent of the Los Angeles Unified School District since 2018. He is a civic leader, philanthropist, and former business executive with a deep commitment to the Los Angeles community. Before he was named superintendent, Austin served as first deputy mayor of LA, was publisher and CEO of the Los Angeles Times, and was co-chair of the LA 2020 Commission and the LA Unified Advisory Task Force. During this pandemic, Austin has overseen the largest food relief program in the country, providing millions of meals to students and families in LA. Austin was elected to the Academy in 2018 and is a member of our Los Angeles Program Committee. Sarah Bleich is a professor of public health policy at the Harvard Chan School of Public Health. She's the Carl K. Pforzheimer Professor at the Radcliffe Institute for Advanced Study and a member of the faculty of the Harvard Kennedy School of Government. Sarah served as a senior policy advisor to Michelle Obama's Let's Move initiative and has been awarded for excellence in public interest communication. She recently co-authored an op-ed in the Boston Globe entitled Listen to the Science and Reopen Schools. We will begin with short presentations from Austin and Sarah before opening the floor for questions and discussion. I encourage you all to participate at that time by using the raise hand function. But first, let me hand things over to Austin Beutner. Austin?
Thank you, David, and thank you all for taking a little bit of time to join us in this conversation. I'll be relatively brief with my remarks because I'd like to leave time for questions and a discussion. But let me set the context of Los Angeles Unified and some of the challenges we face. So if it's okay, I'll ask my colleague or someone from the Academy to bring up just 4 or 5 slides. That's me, by the way. That's me with a young student on a playground in the good old days when we could be on a campus. And it's a good reminder that what we do in public education is teach the fundamentals in literacy, provide fluency in math and a foundation of critical thinking. And for so many of our students, it is the path out of poverty. And for all, it is a promise of a better future. For those, next slide, please. For those who aren't familiar, Los Angeles Unified is big, messy, complex, and we serve, to less than politely say, those who need us most. We're across 710 square miles. To give you some sense of dimension, you could put the next 5 largest school districts in the country within our borders and still have plenty of room. In addition to 700,000 students, we have about 75,000 staff. And as we talk about a transition to this type of virtual or online organization, we have a challenge in serving the needs of students. We also have a challenge in that we are managing a complex set of operations remotely. I've seen different tech company CEOs been asked about the challenge to going online. When they recruit everyone online, they exist online, they may cohabitate in offices, but their organization, their business models was all set up around technology and the use of it. Ours is not. For students, for the families we serve, or for our staff. About 80% of the families we serve live in poverty. To put some dimension around that, about 1/3 of the families we serve live on something less than $20,000 of household income in Los Angeles. About 83% of our students are Latino and Black. We serve students of color living in poverty. That's the journey that we're on. Next, please. To give you some context of COVID, this is one of our high schools. About 3,000 people are in that high school every day, students and staff, teachers, those who work in the school. In the course of an ordinary day, they are in contact with another 100,000 people. It might be siblings at another school. It might be family members at home. So when one has a picture of the impact of a pandemic and a spreading disease in the community, Los Angeles is a spider web of connections. We're not a small Midwestern town that I grew up in, where everyone walked to the same school, and that community and school could be isolated, if you will, and kept from the spread of a disease like this. Next, please. Since March, we've had to do a lot of things differently than would have in the past. Most of this we did not bother to ask for permission. We just did because we think that's what we have to do in a pandemic. We started, as David referred to already, we started providing food relief to families the day we closed school facilities. In ordinary times, more than 80% of our students live in poverty, and we serve children in schools. We quickly converted to a food relief effort for the community, serving children and adults, no questions asked. And to our knowledge, it's the largest food relief effort in the country. We've raised support from the community, more than $20 million from businesses and individuals, whether that's cash donations, donations of goods, services, and other things, but we've managed to rally community support. We have provided every one of our students with a device and internet access if they needed it. We didn't come into this pandemic in a position of strength. Schools in California are chronically underfunded. To give you some dimension of that, California invests about $17,000 a year in each student. In New York, the comparable figure would be about $30,000. That $17,000 has been well chronicled, the inadequacy where you might see a class size that is too many students in it, a school library without a librarian, schools without school nurses, or students without those devices that they need. We wouldn't take the lack of adequacy as a sufficient answer for the families we serve. So starting back in March, we've provided every student who needed it with a computer and every student who needed it with internet access. And I'll come back and talk about that because that's not normally what schools do. The digital divide exists. It's very real, not just in rural Wyoming, but in communities in urban areas where families on the other side of the divide cannot afford access. We are providing that lifeline for them. We reached out to other partners, and I think a couple of them might be on this call, our friends at PBS, recognizing that the foundation of distance learning actually was established many, many years ago in PBS. And we wanted to provide a low-tech and a high-tech solution. We partnered with a great set of colleagues at PBS. There are student-centered learning shows, which were on the air the day we went to remote learning in Los Angeles. I'm really pleased to say about 200,000 people each week watch them. And anecdotally, I hear it's lots of families and kids together, and maybe it offers a respite from some of the challenge or trauma that's outside their doors. It has been adopted by school districts and PBS affiliates in more than 30 states. We've had to provide training for all who work in our schools. So educators, meaning those with a teaching credential, otherwise about 35,000 in our schools, we provided this without missing a day of school. We felt it was important not to take a week or 10 days to collect our thoughts and train because so many students and families rely on the structure and being part of a school community. So we continued to do this while school was in session. We also provided the opportunity to be in summer school for all students. First time we've ever done that. Next slide, please. I'll give you a little dimension of what that was about because one of the things that we saw very quickly is once we leave the friendly confines of the classroom, one of the most important challenges becomes actually engaging a student. We infer a lot in a student's attendance in a bricks and mortar school, including that they are engaged in their learning because they're in the room, it's a captive audience. That changes to a form or setting like this. Families who might not have the same convenience most of us have in terms of good internet access, a quiet place to learn, many distractions at home, and many students who might be easily distracted. Certainly my children are. So we took this chance over the summer to see what can we learn, what could we do differently with a real focus on engagement. I'll just highlight two which draw some examples, and these are just a few. We worked together with James Cameron, the storyteller, the filmmaker, to create course about the voyage of the Titanic. Our teachers led the course, created curriculum around the foundation of science and critical thinking, woven math and literacy. And James added that special magic. I tuned in several times during the course of the summer. The last class, James plugged in from New Zealand, where he's filming Avatar 2, 3, 4, 5, whatever that might be. And you can see the number of participants in a Zoom. Started at 5:02 and it ended at 5:02 for an hour. It was captivating. I was getting texts during the course from my colleagues saying, you're supposed to be somewhere else. And I didn't want to leave. It was fantastic. It's a different way to engage. With Fender, we had been working for the better part of a year to bring music back to our schools. One of the symptoms of inadequacy is we don't have music in all of our schools. We flipped it on its head. We approached the idea to provide a free guitar, a free electric guitar and amp, bass, ukulele to students and do this virtually. Teacher-led instruction supported by Fender. We had more than 1,000 students in the summer. We've doubled the size to the fall. And again, if you had a chance to participate, you'd see students engaged, and we're offering opportunities to many students and families who never would have had access. So we're trying to make a lemonade out of lemons, if you will, and at the same time learn along the way. Next, please. The last piece I just want to touch on, and I'm sure Sarah will get into this in more detail. So many challenges society face present themselves in school, but they're not necessarily school challenges. We spoke of the hunger of poverty. Well, we're feeding hungry children and adults. Is that the responsibility of a school, a city, a county, a state, a nation? One might not typically think of schools as the provider of sustenance for a hungry community. Internet access. We reached out to Verizon early on in this pandemic in late March, early April, and reached an agreement which has since become a precedent for the state of California, where they sell us deeply discounted broadband access that we can provide to students and families for free. Again, we needed to because we wanted to bring every student back and reconnect them with their school community so they could continue to learn. One wouldn't typically think it's the responsibility of schools to make sure every family has internet access at home. We saw a challenge. We decided to take it on because it was necessary. The next chapter will be how we plan for a safe or the safest possible return. We can't mitigate all the risk. And since March, listening to the advice of the World Health Organization, where they have said test, 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 we believe that has to be part of the foundation. So we have adopted health practices in our schools to the greatest extent possible. They are cleaned with an ionized mist. So we've ionized the disinfectant, it sticks to every surface, it's cleaned. We're providing masks and personal protective equipment. We have changed the membranes in our air conditioning systems to now run 24/7 with an MERV 13. We went from MERV 8s, 9, 10, 11, 12, right past them to 13. And what 13 is the membrane itself is the same membrane as an N95 mask. So our classrooms have purified air through an N95 mask, ionized disinfectant. The floors are marked, the desks are further apart. And actually today was the first day of schools at schools. And some of our teachers have chosen to teach from the classroom. And as I say to them, you can choose to teach from home or your classroom, but we guarantee you the classroom is going to be as clean as any place you're going to be today. Certainly cleaner than that Starbucks you might have stopped in for a cup of coffee on the way here. So we'll do the health practices. But the missing piece, we think, is better information, more information about the spread of the virus in the communities we serve. Now, the overall level of virus in Los Angeles is still at a way too high, at a point where it is not safe and appropriate to consider a return of students to schools. We're about 250 cases per 100,000. I'm sure Dr. Bleish will take us through what that means in more detail, but that's way off the charts. Our testing is still in the high single digits, still way too high. She'll talk a little bit about what some of those standards are. But as that approaches in the weeks and months ahead, we want to lay a foundation where we have knowledge, where we can test before students, before staff return to a school facility. Initially, it will be baseline testing, then it'll be a pattern based on some epidemiological advice. In addition, we're setting up a system which will allow us to trace the contacts of any individuals who test positive or show symptoms. So we're building a robust system to do that. Now, again, this is not something schools do. We have brought in those we think have expertise who can help us. We have 3 universities, Johns Hopkins, UCLA, and Stanford. We have 2 technology companies providing the testing. One, an innovative startup which can provide tests, overnight results at a fraction of the cost of a traditional PCR test, still a PCR test. One more traditional system which has the cheek swab because we have little kids. So the nasal swab for the bigger kids and the cheek swab for the littler kids. And we brought in Microsoft to help us with an end-to-end system to not only manage the workflows, manage the data flows, and make sure that our research partners and all health authorities and others who need to know the data have it. We're building a robust communications capability because we're not trying to create a false promise. There is still risk. And one of the most important things individuals can do, even with testing and tracing, is make sure to practice the appropriate health practices. This is a big initiative for us. We didn't see it being done at the local county health level or the state level, but we didn't see a path to have the information we need, not only to be back to a school and keep our school community safer, but to keep students in school. And if we observe some of the challenges that are being had in other parts of the country and around the world, a school might open, but it might close just as quickly because one incident, middle school kids, by lunch, they're all home. Nobody can trace or track where that case came from, and everybody's frightened and stays home. So as we approach the potential to be back in school in, let's say, 2 months' time, we don't know yet, but let's use that as an example. This gives us a couple of months to lay the foundation in science, and all we are doing is rooted in that same science, which Dr. Bleisch will take us through. Kids can carry it. People without symptoms can transmit it to each other. We have multi-generational groupings and multi-family groupings in schools. I was in a middle school today, so those 12, 13, 14-year-olds have a 50-year-old teacher, 30-year-old bus driver, 70-year-old grandmother at home, and we're bringing them all together. And unless we want schools to become a petri dish and spread it back into the community, we have to find ways to isolate risk. So this is the latest chapter. We hope it provides for a safer return and a foundation to keep students and teachers in schools. And I'll close on that note because what we do is try to provide the education which gives a foundation for opportunity and hope for the future. And we know better than almost anybody, as parents, as educators, the best place for children to learn is at school. Those who are struggling the most are our earliest learners. I've yet to see someone show me how to teach someone to read online like this. Our students learning English. Our students with differences and disabilities, or those who might have been struggling before school facilities closed, we know are struggling the most. And it's imperative we be back in school facilities to address those certainly with highest needs as quickly as we can. And the only way to do it is going to be based on science. So with that, again, thank you. I look forward to the questions, and I think I'll turn it over to Sarah or David for the rest of the introduction.
Sarah, please go ahead.
Thank you. Well, it's great to be here. Thank you, David. Thank you, Austin. So based on the op-ed that David mentioned, which I did with colleagues in the Boston Globe, I've been asked to talk a little bit about what does the science say about reopening schools. So at the bottom line that I sort of want to leave you with is there are some benchmarks that we can be thinking about with appropriate risk mitigation, and we'll talk about what that means. It seems as if schools should be able to open in areas where the positivity rate is less than 5% over the past prior weeks. And positivity is calculated by dividing the number of positive tests by the total number of tests. And then the second benchmark is that the daily number of new cases is less than 10 per 100,000. Some places are using a 14-day moving average. Some places are using a 7-day working average. But those are sort of the two metrics to understand what do new infections look like in a community. So based on those two, let me just give you a sense of where the country is right now. So what you're looking at here is the current positivity rate by state as of today. And again, positivity is the number of positive cases divided by the total number of tests. The states that are in the shades of green are states where the positivity is below 5%, and that's 19 states and DC. And you can see most of those states are concentrated in the northeast region of the country. So that's positivity. What about the current case infection rate? So the slide before showed you states. Now I want to zoom in and give you a sense of, in addition to there being variation across states, within states at the county level, there's huge variation right now. And so colors in green or counties in green are showing you places where the case infection rate is less than 1 case per 100,000. Yellow is where there are between 1 to 10 cases per 100,000. And so if I were to zoom this out to the state level, what you would see is that there are a number of yellow states. There are no green states. But as of today, this gives you a sense of what the case infection rate looks like around the country. There's a tremendous amount of variation. So from a public health perspective, which is how I come at this conversation, there are a lot of harms to closing schools and having them closed. And you've heard some of this from Austin. Obviously, if students are not logging in the context of remote learning, there's a lot of lost learning. So there are anecdotal accounts of some areas of the country where a third or 2/3 or even 75% of students never even logged in last spring. And we care a lot because that often happens in lower resource areas. And if you have less learning during remote education in lower resource areas, then that has the potential to really exacerbate these long-standing gaps that we know exist in educational attainment by race and by income. We also don't just care about the education outcomes. Schools can do a lot more. And so there have also been accounts that with kids home, that there have been more violence towards children. There is evidence which suggests that children are experiencing more poor mental health outcomes, anxiety, depression. And an area which I spend a lot of time working on is hunger in children. And so for some kids, half or even 2/3 of their calories are coming from meals and snacks received at school. And a lot of that was paused or completely stopped due to the school closures in the spring. And so there are a lot of potential harms to having schools closed right now. And you heard some of that from Austin. What I want to try to do is give you a flavor of what does the science currently tell us in 3 different buckets. So one is, what is the risk of infection and serious infection in kids? What do we know about school-based outbreaks and risks to teachers, staff, and other students? And what's the effect of school closures on overall community COVID-19 rates? For each of these buckets, I want to give you the top line takeaways and then talk you through some of the evidence. I'm not going to go through all of it. There are studies coming out on a daily basis. And so I just want to give you a snapshot of what we're seeing right now. So with respect to the first bucket, the risk of infection in children, what the evidence says is that children are less likely to become infected in the first place. Nearly universally across all studies, rates of serious illness are lowest among school-age children. And then rates of childhood infection, while they have gone up as the overall national case rate has risen, the complication rates for children remain quite low. And so what is some of that evidence? And so if you look at Switzerland, for example, that is a study that had about 2,800 people in it. And children ages 5 to 9 were 60% less likely to be infected than adults. The China study, which is on the right-hand side of the screen, that found that children were at an infection rate of 4% compared to an infection rate of 17% in adults. Now, when people hear low infection rates in children, they often point to 2 things. Well, that's the case because schools have been closed, or that's the case because children are asymptomatic. These studies listed here on the slide are the 2 best pieces of evidence that we have right now that push back on those 2 points of dissent. And so the Iceland study happened when across that country, schools did not close. And what they found is that infection rates increase with age, but that children under 10 had half the infection rates compared to adults, despite the fact that schools did not close. The second is a study that was done in Italy that came out recently in a very high incidence town, and it happened just at the start of lockdown. And what they found is that while there was a 3% infection rate among adults, it was 1% among children ages 11 to 20 and 0% among children 0 to 10. And this is really our best evidence that risk of infection is lower among children. We also know when we think about serious illness that amongst 2 studies in China that included together about 2,700 children, across those studies, about 6% of the children with confirmed cases of COVID-19 developed severe or critical disease, and 2 of them died. The rates amongst adults of both death and serious complications are much higher. We also know that children are less likely to get hospitalized than adults, but a point that I want to underline here is just as Black and brown adults are more likely to be hospitalized, so too are Black and brown children. So second bucket of activities, what about school-based outbreaks and risks? And there are 2 points I want to make to you here. The first is that there's not a lot of evidence of school-based transmission of known COVID-19 cases. The second is that risks of teacher and staff infection in countries that did not close schools are similar or lower than population averages. And so if we dig into that a little bit, I want to point your attention to the study in Australia, which is on the left-hand side of the slide. In that study, they tracked 27 individuals, 12 students and 15 teachers. They were either in the early care setting or in the K through 12 setting. Those 27 people came into contact with about 1,500 people. And amongst the people with whom they contacted, the infection rate was just 1%. Now, many of you probably heard about the South Korea study that got a huge amount of media attention a couple of weeks ago. And so I want to take a minute and talk about that. When the study originally came out, the take-home point was children ages 0 to 9 have half the likelihood of transmitting the infection compared to adults. That was not a surprising finding. What was a surprising finding was the result from that paper that children who were older or teens had rates of transmission as high or higher than adults. Well, there was a lot of pushback based on the results of that study, and it was reanalyzed. The same data was reanalyzed. And when it was, they found that after you remove the children who were infected at the same time as adults in their household, that the risk of child to adult spread was actually extremely low. It was only about 0.5%. And so it contradicted the prior study, which got all the attention, which showed high teen transmission rates. And another area to just look at is, well, what are some of the differences by profession? And so I just want to point your attention to the top study here on the slide, which is looking at Sweden. Sweden, as you probably remember, did not close schools. And what they found is that COVID-19 infections were highest among taxi and bus drivers, while the rates among teachers were right around the population average. Now, if we pan out a little bit and don't just look at countries, but look at clusters of countries in certain regions of the world, if you look at the top part of the slide, that's showing you evidence for 22 European countries. And they found that reopening schools did not lead to a rise of COVID-19. And when you look within several Asian nations, they found that opening schools was associated with small and infrequent outbreaks. So what about the third area of evidence? What do we know about school closures and community spread? And so there are three main take-home points for you here. And Austin touched on the first one, which is if you get infected at school, it can be brought home. The second is that school closures may be among the least effective measure to flatten the curve. More effective is closing restaurants or closing bars, but closing schools does not appear to be one of the more effective ways to flatten the curve. But then third, from a research perspective, it's really hard to do these studies because regulations are changing all the time, what is open and what is closed. So in the United States, this evidence around school closures and community spread is mixed. And so one study came out and it said school closures are significantly associated with reduced infection, but the study did not control for policies going into effect at the same time. Another study came out and it said there's no evidence that school closures are associated with transmission. So from the evidence here in the States, it's really hard to draw conclusions. In Europe, there was an analysis of 11 different countries, and they found that there was large reductions in COVID spread from the lockdowns, but they did not see any significant effect of school closures on COVID-19 on their own. So you put all that evidence together and you say, okay, well, if you're keeping infections rates down, what are the public health practices that are being put in place to actually make that a reality? And that's another area where there's been a lot of progress around evidence. And so there is a comprehensive set of critical health and safety requirements that are gonna really ensure or reduce risk. And so they're really gonna mitigate risk. That includes physical distancing, masks. And just yesterday, a study came out in JAMA that showed if you pair a face mask with a mask, you can actually reduce spread even more. Improved hand hygiene, well-ventilated indoor space, clear testing strategies, and community benchmarks for reopening. You need to have goalposts so you know what you're working toward and when there's sufficiently low risk, and Austin sort of pointed to this, to actually reopen. Now, obviously, when you have these different public health approaches, they may not fit squarely within the walls, the physical walls of the school. And so just as the healthcare system has had to innovate and be creative to treat the massive upsurge of COVID-19 patients, this is also an opportunity for schools to be creative. And we heard a lot of the creative stuff that's happening in LAUSD. So some things that are happening around the country to sort of spread out the students and allow for physical distancing are adding tents or trailers. The district that's next to mine just ordered about 22 tents to actually bring the students in, but then have them be in school outside. Schools can stagger arrival or dismissal times to thin the students. You could limit the number of adults, including parents, in indoor spaces. It's important to know that during this whole time, roughly 6 or 7 months, many daycares in the country have remained open. And for many of those, parents may not set foot in the door. And those could provide some instructive information about how you can interact with parents in the educational setting. It's also the case that to sort of thin out the students, you can convert gyms or cafeterias and libraries to create more space. But I do want to point out that even if community spread is low enough, and even if you have all the public health measures in place, there are still going to be people for whom the risk is too high. They may be children, they may be faculty, they may be staff. And for those populations, you really have to have robust and equitable systems that allow people to opt out of in-person instruction. And so, why do we care so much about these public health actions? And I would say really the most important point is what we want to do during this time, which is challenging for everyone for all different sorts of reasons, is we want to maximize learning. And one way to maximize learning is to reduce these lengthy quarantine periods. And so if you have effective tracing, if you have effective testing, that allows you to shorten the amount of lost learning that children are experiencing and try to get them as much classroom time, either in person or remote, as possible. It also helps you maintain education while reducing risk for students, for staff, and the community. And as Austin pointed out, the really hard thing about this disease is that you can be asymptomatic and carry it. And so the spread then, it's really important to have public health practices in place that can try to mitigate that asymptomatic spread and keep the numbers down, because obviously, as we well know, transmission can occur very, very quickly. And then, I think it's worth acknowledging, and I have two elementary school age children, there's just a lot of fear out there. Parents are deciding now, do I send my kid back? If there's an in-person option or a hybrid option, do I keep them at home? There's a lot of mixed evidence about the science. It's coming out rapidly. And I think if we do a better job of communicating what we know and how do we mitigate risk, I would hope that that can help reduce some of the stress and the fear and the confusion that parents and teachers and staff are really experiencing right now. So I have two last slides for you. One is, based on all that evidence, I do want to offer up some important caveats and considerations that you should keep in mind. And the first is something that I already said, which is, for this topic area, the science is changing so rapidly. And so this is a snapshot of what we know right now. Next week, we'll probably learn something else. A second point is something that Austin said, which is lower risk does not mean zero risk. And so we know that if there are no safeguards in place, children can transmit COVID-19. We saw that with the outbreaks in Georgia that happened in the summer camps. We also know that closing schools does not mean zero risk. Infections are still going to happen. And the risk for schools has to be interpreted in the context of, well, what's happening in a given community? Are cases going up? Are cases going down? Are cases unacceptably high? And so there's a hyper-local element to this that has to happen for this decision about opening in-person versus hybrid for that to happen. Another point, which I think is so important to underscore, and this is something that I experienced personally, is either the remote or the hybrid models are relying on this massive, untrained, unpaid, overextended workforce, and that's the parents. Some parents are going to be able to afford to hire babysitters and nannies to really help with the online learning, but there's a huge swath of the American public that can't afford to do that. And so in that case, many parents may have to work while children struggle through this online environment. And what is likely to happen is that it's going to exacerbate the existing educational disparities and all the well-being that we know is associated with being in person and learning in person. And as Austin said, the priority is getting kids in school in the lowest risk way possible. So this is where I want to end and just think about, this all started 6-7 months ago. And when everything shut down, we did not know a lot back in March about COVID-19. Now we know two very important things. One, there is strong evidence and consistent evidence that children are lower risk transmitters of COVID-19. Two, there is more evidence on public health tools that can reduce risk between students and parents, between students and teachers, and so on. The second is that as we think about decisions that are happening all around the country right now about opening schools, My hope is that they can be driven by science and not politics. Wearing a mask should not be a red decision or a blue decision, depending on the state in which you live. Wearing a mask makes sense because it's one of the most proven ways to actually reduce spread of COVID-19. And finally, all of these different changes that we've talked about cost money. And schools don't often, or probably almost never, have the resources that they need to implement all these changes. And so the HEROES bill, which was passed by the House back in May and has stalled in the Senate, included tens of billions of dollars for K through 12, some of which could have gone towards some of this public health mitigation that could help bring students back to school. In the absence of funding, it is a very tall order to expect school districts around the country to implement all these strategies consistently and to keep the risk low enough to allow children to be in school. So let me stop there, and I look forward to your questions.
Thank you so much, Sarah and Austin, for your very thoughtful comments. And now we invite questions. As I mentioned earlier, the way to ask a question is to go to the participant list on the bottom and raise your hand by clicking raise hand, okay? And I see the very first hand from Theodore Groves.
Thanks very much for that enlightening presentation, both of you. I'm interested in if there are any studies of spillover effects from one jurisdiction to another. I mean, it's one thing for an area to be green on your map, and another, but if it's next to a red area, you know, is there a danger in opening the schools, or what is the spillover effects from one district to another that can occur, and how does that affect the your recommendations?
Yeah, that's a great question. So I think if there's one thing that has become painfully clear is that COVID-19 knows no boundaries, and so it does not respect state lines or district lines. And so what some districts are doing, to get to your exact point, is they're having benchmarks that are both for the town and also for the state. Because you could be in the middle of a state, middle of a green state, you could also be right on the edge next to a red state, and that will have big implications for infection. And so thinking about these benchmarks then about community spread, you just have to understand in your community, what do the numbers look like? And if you're next to a state with higher infection, chances are infections will go up where you are. And so then you have to be able to track that and know where you are as a community. I hope that answers your question.
Yes, so, but still, if you have a snapshot today and two adjacent communities, one may be okay and the other not, do you have a risk, higher risk of having that turnover if, you know, if both of them were green, if say, or both of them were okay to open? I mean, it seems to me logical that you would, that if you're, and that your recommendations should actually include the information that you would get from adjacent areas. If there are studies that show that there is danger of that spillover effect.
That's one of, just let me take a different tact on that. One of the reasons we are starting the testing and tracing effort is we're 700 square miles by ourselves. Los Angeles serves diverse communities throughout. We have everything from small isolated schools next to farms in Los Angeles to dense urban. And what we hope to do is put more micro information, if you will, people pattern and information pattern. So if one looks at Los Angeles County is 4,000 square miles. So if Los Angeles County is red or orange or green or 200 versus 20 or 10, that all matters. But if we're going to seek a path to keep schools open and sustainably open, it's the pattern in each individual school ultimately, which is going to set the foundation of science for that school, which is why we're going to do, it's almost micro-targeting coming to campaign sort of. We need more granular information, I think, better data to manage the inflow and outflow of certain schools.
Thank you.
Sarah, did you want to add anything?
Nope, nothing else to add. Thank you.
Okay. Next question is from David Weinstein.
Oh, thank you. In this uncertain time, many schools, understandably, are adopting flexible and hybrid models. They're models that change in response to local conditions. But I wonder if you can comment upon the importance of routine routine in the lives of students, both for health and for learning outcomes, whether it's waking up or eating and exercising, or doing reading, writing, and arithmetic at set times each day within the overall framework of a seasonal calendar.
Sure. I'm again, Sarah, happy to take a first crack. The structure matters. Again, we've learned since March, we learned over the summer, you would see us with a published structure for school, what time school starts, what time homeroom is, what time different patterns of instruction are, breaks in the day for nutrition, for individual activity, things like that. So structure matters, as does being part of a school community, even if it's Zoom, better than being by yourself. Now, one of the things, I'm not inferring in your comment, but it's important to understand online, hybrid, and all back, health conditions make it different levels of health conditions dictate that, not us. We'd like the all back. We're all online now because we can't have congregate settings of children, period, end of story. When we can have limited congregate settings with social distance practicing, we'll be hybrid for a very simple reason that our buildings and our teachers, if we cut a class size in half to spread everybody out, we still got the 1 or 2 teachers and only so much room in the class. So students have to be not in that classroom, means somewhere else, which gets us to hybrid. And the full return is some later date when health conditions allow. So what we have mapped out instructionally is a scope and sequence for a year, irrespective of whether a student is at school in a hybrid model or at home, because it might toggle. We might in 2 months, if we're down to the 10 or whatever level Sarah and other experts might think is appropriate, bring students back in hybrid, and it could flare up, or it could flare up at a school. We toggle back to online, we go back to hybrid. So I think it's not likely that it will be an open or close. It's a rheostat that gets turned, but structure and continuity of structure for students, hopefully throughout the scope of the school year.
And I would just add to that, anecdotally, what I'm hearing is that there's a big effort right now based on learning from the spring for more synchronous learning, which will create those schedules that often didn't exist. The caveat that I would add to that, though, is for families where, the children can't necessarily learn at exact times because of parent work schedules, it raises those same equity concerns. And there's a lot of really impossible questions right now. And I think it's hard to know which one's exactly right. But my sense is that the plans that states and districts are putting into place are really designed to keep information flowing as much as possible as these different transition states are happening.
Thank you.
Bob Hauser, question?
Respect to return to the reopenings of schools. There was a recent report by the National Academy of Sciences which emphasized the important, what should I say, gave greater force to an argument for reopening schools for kids up to and including the 5th grade than for older children. And I wonder whether that will affect the reopening plans in the Los Angeles Unified School District, or whether it has affected reopening plans in other places. Thanks.
Sure. Thank you. Again, we're balancing 3 often conflicting objectives, right? The learning needs of students, where school's best. The health and safety of the school community, which is children and adults. And the needs of working families, because part of this conversation also has to be about structure and routine for a family, because we serve the children of essential workers and we serve families for whom work is essential to have food on the table and a roof overhead. And one of the things that we are exploring, it is probable, not no guarantees, is that we will look to return certain cohorts before others. It's not a one size fits all. So one could imagine, to your point, elementary coming back before high school. One could imagine our students with differences and disabilities coming back in a very specialized way before other students who are more able to learn independently come back. So yes, I think that has to be one of the tools in the toolbox to be seen. Now remember, when we bring young learners back, we may bring a young teacher or an old teacher. So we still have a disparity of the multi-generational structure in a school, and we still have the multi-generational structure at home. So a 10-year-old or a 5th grade, an 8-year-old, 9-year-old, 10-year-old, 5th grade might be lesser risk for themselves, the risk of transmission to the bus driver, the teacher, or the grandmother at home is still part of that equation. But yes, to your point, I think we're likely to see more emphasis on early learners and more awareness of the risk as students get older and more likely to be the spreaders, as some of the science seems to show.
And Robert, I would just add to that it's really hard to put a finger on the pulse of what all the districts around the country are doing because it's changing so much. My own district changed overnight from one model to another. But what does seem to be the case, and this is sort of building on what Austin said, is that the younger children, because their transmission rates are lower and because it's just much harder for them to learn online, they seem to be their priority populations. The transmission amongst teenagers looks more like adults, and frankly, they are able to learn more online than younger children. And so it then makes them a population that is more amenable to the remote environment.
Next to Graham Allison.
Thank you very much. What excellent presentations. I don't know if the slides are going to be left up, but if they are, I think they would be educational for all of us. Sarah, this is for both of you. When I've been studying this, trying to understand it, and obviously if students go back to school, they have a greater chance of transmitting the flu and catching the flu. So I looked at the evidence about death from flu, and lo and behold, if you ask the question, are children more likely to die from the flu or from coronavirus if they're in kindergarten or elementary school or grade school? 5 times as many die from the flu. Then I look at the kids that are even in high school and college. More die from the flu than from coronavirus. So maybe we'll save their lives by closing down schools to keep them from catching or transmitting the flu. But if anyone had proposed that, we would say, wait a minute, we thought schools were about education. So I appreciate both of your clear commitments to trying to remember what we're trying to do here and balance competing risks. But the question is relative to the flu.
So relative to the flu, so you're sort of pointing to transmission of the flu happens, transmission of COVID-19 happens, but there's more flu transmission among children. That is correct. And the reason for that appears to be that when it comes to COVID-19, kids are very asymptomatic. They're not snotty, they're not sneezing, they're not sort of putting a lot of droplets into the air. And so for a lot of reasons, kids they're not immune, obviously, but the symptoms that make adults so contagious are not present in children. Whereas with the flu, that is not the case. And so that's why the pediatric population has much lower rates of transmission.
Let me, Graham, though, just to again, the scales of a good decision. Let's remember the health consequence of flu is very different than the health consequence of COVID. So we might seduce ourselves into thinking, well, we can get all those 5th graders back tomorrow. Show of hands on this call, who wants to go teach that class? I'm a high risk category because of some other maladies. I'd have, second thoughts as to whether being in that class for me or for the teacher who might be in a high risk category is appropriate. So we have to remember schools, roughly, you saw the numbers in Los Angeles Unified, for every 10 students, there's an adult. And we have to balance the risks of both.
So, but if I could just follow up briefly, of course that's right. And both of you emphasized that there's no one size fits all for this. So I can understand why somebody at higher risk shouldn't be in the classroom. And indeed, I can understand why somebody who lives with a person who's at higher risk may be treated differently from somebody who doesn't. But the idea that for if we're concerned about, if we take death as the most decisive harm, and if we look at the fact that more die from the flu than from coronavirus, the children, if we can find a way to educate them managing that risk relative to the flu, which we've done in the past, and then the problem is an old guy like you or me who are at risk, greater risk, well, they should not be in the classroom. Somebody else should be in the classroom, or they should be remote. So that I just think that balance I haven't generally seen in the conversation. Sarah, I don't know whether you've looked at the flu comparison or other disease. If I just look at death risks for kids Actually, I mean, I'll give you another zinger. If they drive every day 10 miles to the school and back, the risk of their dying from driving there 10 miles a day is greater than the risk from dying from coronavirus, if I've got it.
So I'll make two quick points. One is you're underlying a really important point, which is schools were risky before COVID-19 ever happened. Yes, you could be on a bus that could get hit on the way to school. There could be an earthquake. Like, schools were not a no risk environment. But obviously the big difference between the flu and COVID-19 is we don't have a vaccine for COVID-19. And so without the right public health protections in place, the risk of spread is simply too great.
Next question from Jack DeGioia.
Thanks very much, David, and thank you, Austin and Sarah. This is just a terrific session. I think this is a question for Sarah. We're in the early days of reopening our college campuses, our colleges and universities, and I'm just wondering, from your perspective, any insights or surprises from these early days of the reopenings of our colleges and universities, how they may be relevant to the topic that we're discussing today?
Yeah, so I have not been at all surprised that many universities have decided and colleges have decided to go fully remote for the first year. From an educational standpoint, it's reasonable to expect you can get as many hours of learning in a remote environment as you can in a brick and mortar environment. Now, there's obviously the social pieces that matter a lot. I think that what has surprised me is that some universities are in fact going back in person, and just hearing about some of the steps that are being put in place. Like, I heard of one university that's requiring twice a week testing for every single person. I just wonder how hard it will be to keep up with these different measures. And I think it'll be interesting to see. Many schools have just brought back freshmen, and the upperclassmen are remaining at home. And it'll be interesting to see to what extent the college age population can keep those appropriate safeguards in place. Because one thing we've seen in some of the news coverage is a more cavalier attitude toward risk, which has led to these hot spots of infection. And so the hope is that that doesn't happen at universities. And my concern is that when the flu comes in the fall and the early winter, and cases start to spike and COVID spikes with them, that a whole host of students will get sent home again and not asked to return back after Thanksgiving.
Thank you. We have, I think, time for two more questions, and I see two more people who've raised their hands. So first, Robert Jervis.
Thank you. Very, really interesting and helpful. My question's more for Austin. I agree, of course, as a political scientist, I agree the science should count, but there is politics, and specifically the role of the unions that represent the teachers, who many of whom are high risk. So my question is, in the LA County, how closely have you been working with unions, and from your knowledge there and of discussions with your counterparts around the country, what's determined whether these relations have been productive in solving the problem, and what the factors tend to have just led it to be highly conflictful?
Sure, I think you raise an important issue in public education in California, at least, not necessarily true across the country, but many parts of the country. We work with a series of labor partners, teachers unions, unions representing our bus drivers, our cafeteria workers, those who maintain our schools. And I'd have to say, maybe to the surprise of many, we have been shoulder to shoulder with our labor partners. When we closed schools in March, we closed before there was a single occurrence in a school, purposefully, because it was the great unknown. We did not know the level of risk, and we thought the right thing to do was close before there was risk in the school community, and our labor partners agreed. We made a relatively early decision to be online to start the school year back in July, one of the first large school districts, because we saw risk and our labor partners saw the same risk. And I think one of the things that gets politicized too quickly is labor for or against, or which side are they on? We're all on the safe side. We're all on the support students as best we can. And at least in Los Angeles, it's not been an issue of labor versus management on different sides. I think labor has articulately put forth the adult issue in a school. That doesn't mean they don't want to be there. It doesn't mean they don't love their students and aren't passionate about teaching, but they represent both literally as unions and figuratively as the people themselves, literally as teachers too. They're in the classroom. So before we encourage all to be back in a school. I think it's important we listen to the voice of labor, and at least they've been a constructive partner with us in Los Angeles. I can't speak to other parts of the country. They're very excited, for instance, about the health practices we have in school. We have a labor management collaborative who visits schools together, and we continue to refine it. You know, the voice of educators, I've heard schools within the last several weeks, you know, an elementary school, for instance, in a hybrid model, a school library looks like a risky place to come in and everyone touch the same books. So a teacher said, you know, we could put our books on a cart, like a little mini bookmobile in the school, and bring them. And we brought a family into a school, and they saw where we put the arrows on the floor for one-way traffic. And they said, gosh, when students are in the hall going one way, no one can see the arrows. So we put the walls up on the arrows on the walls as well. So, you know, the voice of labor, the voice of people in the school is an important part of the calculation, but at least thus far, a collaborative relationship. We have the same objective, which is keep the school community safe and at the same time do the best we can for our students.
Thank you. A last question from Alfred Spector.
Hi, thank you very much for the excellent presentations. They were both really, really great and clear. This one probably is for you, Austin. It would seem that until such time as we have a really good therapeutic or vaccine, that when we reopen in person, we're inevitably in somewhat of a hybrid mode, because there's some populations that are just at more risk, and it might work for most people, and Graham's comment is right, that most people might have a lower risk than they get from the flu perhaps, but some won't. Some people will be at great risk. How difficult is it to teach in the hybrid mode? We have some experience in the Coursera, you know, whatever kinds of modifications we can make to that when it's clear what's going on, but how do you do hybrid so well?
How will we? Because we don't yet, but how will we? Just to restate slightly. And part of what we're doing is laying a foundation in science to keep hybrid going, which is why the testing, tracing, and health practices, because otherwise it's come back and go back home. And that's not hybrid, that's just on off. But to keep it going, the principles that we looked at carefully are first to use the time in a classroom setting optimally. It's actually caused educators to think really carefully about what does a day in a structure look like? Is an elective in person or is an elective online? Is PE at school? Well, you only got a limited time. Maybe that could be an after school at home. So if it is a 2-cohort model, which we've worked really hard to get to, meaning you're there half the time. Now we're facility constrained, so we've had to really stretch. We have planned to use empty community college space, empty libraries, other things. So you may come to 9th grade at a library all day as opposed to a 9th grade at your high school all day. But 2 cohorts is the key. The cohorts will be different by elementary and secondary. So elementary will likely be morning or afternoon because we think the frequency matters more there. We think foundational pieces in literacy, math, critical thinking for that half day. We think a less structured half day with a little bit of break time, one-on-one tutoring fills out an elementary day in a satisfactory fashion. So it feels much like school because the other half of the day you'll be supervised by us and a different set of folks, just not your teacher. So that becomes a pretty good offering for elementary. Secondary will be closer to half with us, half not with us. But as we've had to flip there, the tension becomes for any high school principals or teachers here, the master schedule. Because the master schedule of secondary is this 3-dimensional Byzantine structure of how do you fit electives, how do you fit choice, how do you fit mandated classes, how do you fit remedial work and APs all in the same place. And we're realizing that there's tremendous tension between that and the science, which says have small cohorts. So our hybrid model in elementary will be the same 10 students in the morning, the same 10 in the afternoon, Monday, Tuesday, Wednesday, Thursday, Friday. If we're to get to that from a health practice in secondary, it means we will have to limit offerings when students are physically together. You just can't have 7 different classes on a student schedule in high school. 10, 10, 10 becomes a cohort of 70, right? That doesn't work. So the tension there is more instructional in the time we have you as opposed to how much time we have you in secondary. A lot of work going into that. I'm confident that our educators are going to get there. But the foundation under hybrid is science and health practice, because hybrid for a week, someone gets it and we can't test or trace to figure out who got it and get everybody to come back the next day. So hybrid one day and closing schools for 2 weeks, that doesn't get us where we need to be. So it's the continuity in hybrid that we're hoping to put in place with our testing and tracing program, as well as the health practices.
Thank you. Sarah, would you like to make any last comment before we sign off?
I would just like to applaud Austin. I think it's one thing to talk about the sites, another thing to actually do it, and I can't imagine what you're doing. So I applaud you.
Let me just clap back. I mean, what we are trying to do is be guided by science, and so while Sarah and I are not working directly on this, others of her colleagues and counterparts at Stanford, Johns Hopkins, UCLA, and others, we're trying to find the best in science, and that's, as learners, we look every day, and I follow her work and others to see what do we learn today that we didn't know yesterday, and try and help inform our thinking. So thank you.
Yes, let me join in thanking Austin and Sarah, both of you, for your time, your very thoughtful work during this difficult period, and thank you to everyone for taking part in today's conversation. Let me remind you to download and share the final report of the Public Face of Science, which we discussed at the beginning, available on our website. So stay well, and thank you very much for joining us.
Thank you, David.